Do you have pain in your knees? Do you want to prevent injuries and improve your mobility? Stop knee pain now! In this video, we will show you 5 exercises to strengthen your knees. We will focus on exercises for beginners, which can be performed by people of any age. They are a series of simple and effective exercises to strengthen and stabilize your knees and enjoy an active life again. Our knees are critical joints that support our weight and allow us to move easily. By strengthening the muscles around them, we increase their stability and reduce the risk of injuries such as sprains or osteoarthritis. Let's delve a little deeper into the knees, review how they function, the causes of pain, and how the exercises we'll review can help us. Although the knee is a joint with a seemingly simple movement, it is a complex joint that requires a delicate balance of forces to function optimally. Its proper functioning depends largely on the health and strength of the muscles that surround it. The muscles of the knee play a crucial role in its movement and stability. They work together to flex, extend, and rotate the knee, allowing us to perform a wide range of daily activities. If these muscles are not properly conditioned, they can cause an imbalance in the forces acting on the joint, generating excessive tension and consequently pain. The muscles surrounding the knee act as shock absorbers and stabilizers, allowing for fluid, pain-free movement. However, when these muscles are weak or out of balance, the joint is put under increased pressure, which can lead to inflammation, cartilage wear, and ultimately chronic pain. Therefore, muscle toning is essential to ensure proper knee alignment and prevent injuries. A program of muscle strengthening exercises can help prevent injuries, improve joint stability, and reduce the risk of chronic pain. They are also necessary to improve athletic performance and delay osteoarthritis. Now let's talk about the main muscle groups of the knee and their importance. Quadriceps is the main muscle responsible for extending the knee, like when you stand up. It is made up of 4 muscles: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The hamstrings are the main flexors of the knee, such as when you bend your leg to sit down. The hamstrings include the biceps femoris, semitendinosus, and semimembranosus. Other important muscles are the popliteus, which flexes and internally rotates the knee; the sartorius, a long, thin muscle that crosses the thigh and helps flex the knee and hip; and the gracilis, which also helps flex the knee and adduct the thigh. Muscle toning is an investment in the long-term health of our knees, so let's review the 5 exercises that will strengthen and protect your knees. 1. Quadriceps series. To start, we will perform an isometric quadriceps exercise. This static contraction, in which we tense the muscle without producing movement, is an excellent way to strengthen these important leg muscles. By maintaining tension for a certain period, we increase muscle strength and endurance, as well as improving proprioception, that is, awareness of our body's position in space. This exercise, despite its simplicity, is essential to lay the foundation for a more complex and effective training. Sit with your legs stretched out in front of you, and then contract your quadriceps muscles, your thigh muscles, and then relax. It is important that while doing this exercise, when you contract your thigh, you try to push your knee towards the floor, towards the mat, or wherever you are sitting, thus activating the quadriceps. You push your knee up, hold it against the surface for about 3 to 5 seconds, and then relax. Do 3 sets of 10 repetitions each. It is a very simple exercise, but it is really effective. If you feel good, you can do 20 or 30 repetitions. 2. Straight leg raise. The following exercise is a great way to activate the quadriceps part, which involves the hip, and therefore, along with the quadriceps series, we will include the straight leg raise. Similarly, with your legs stretched out in front of you, what you are going to do is lean your back a little backwards to have better support when lifting your leg. So you do a quadriceps contraction as we showed you in the previous exercise. Then, without relaxing, we will lift the leg approximately 12 inches above the table. Then we lower the leg slowly and relax. You have to maintain that quadriceps contraction. For this, your knee must be as straight as possible. Sometimes people bend their leg a little and you're not really going to achieve anything because the quads aren't contracting. To activate the quadriceps, we must lift the entire leg straight up, making sure that the position of the foot is also straight, no toe pointing. Raise and lower your leg in 2 or 3 sets of 10 lifts. 3. Quadriceps with short arc. So far, we've focused on strengthening muscles. Now it's time to work on flexibility. Flexibility is just as important as strength, as it allows us to perform wider movements and reduces the risk of injury. To improve knee flexibility, we will perform an exercise called short arc quadriceps. This gentle stretch focuses on the muscles at the front of the thigh, the quadriceps, helping us to increase the range of motion of the knee and prevent muscle contractures. We'll need a foam roller to place under the knee. If you don't have a foam roller, you can roll up a pillow, blanket, or towel. When you place the roller under your knees, you will notice a slight bend, perhaps 10 or 15 degrees. Next, we'll engage the quads to straighten the leg. The knee doesn't come off the roller. Basically, you'll just use the quads to straighten the knee from that short arc of flexion until it's straight. As you lift your leg, activate your quadriceps by making it contract gently and slowly. Do 3 sets of 10 repetitions each, and if you feel good, you can do 20 to approximately 30 repetitions. In this exercise, you can use, if you wish, a small ankle weight on the end of your ankles. This routine is very effective for strengthening your knees. It is also recommended as physical therapy to recover the joint from injuries and to get the knee used to moving again. 4. Bridge. Not only does it strengthen your knees, but it's a great way to increase glute and hamstring strength. This is a very complete exercise in which we will involve the abdomen, hamstrings, hips, and glutes. By raising the hips off the floor in a bridge position, we are simultaneously working several key muscle groups. The glutes act as the primary drivers of movement, while the hamstrings and abs provide stability. This exercise not only strengthens these muscles, but also improves hip flexibility and lumbar spine mobility. Lie on your back with your knees bent. Now what we're going to do is contract our glutes, contract our hamstrings, and lift our hips up towards the ceiling. Hold the raised position for 2 or 3 seconds, and then lower it back down. Do 10 sets of 10 reps, and as you gain strength and feel good, increase to 20 or 30 reps. When it becomes easy for you, you can practice a more advanced version, which is the single leg bridge. To do this, the initial position is the same. The difference is that one of the legs is extended. Lie on your back with your knees bent and your feet flat on the floor. Stretch one leg toward the ceiling. As you raise your leg, contract your glutes and lift your hips off the floor until you form a straight line from your knees to your shoulders. Keep your legs straight in the air. Slowly lower your hips to the floor and repeat with the other leg. It's a little bit more aggressive. It requires a little bit more muscle control and more muscle contraction. It might be something you need to work on, but you'll be activating in isolation the muscles around the knee, like the quads, hamstrings, and glutes. These muscles are critical in providing stability and support to the knee joint, helping to prevent injury. Additionally, strong hips are essential for protecting your knees. By strengthening your hip muscles, you are creating a solid foundation that more evenly distributes the forces acting on your knee. 5. Hip adductors. At the beginning of the video, we talked about hip strength and its role in stabilizing the knee. So one of the main muscle groups that we need to strengthen is the lateral hip muscles, or the hip adductors. Possibly the most important hip muscle in terms of knee health and biomechanics, they are a key muscle group for hip mobility. However, their function goes beyond simple leg adduction. To do this exercise, you are going to lie on your side with your bottom leg bent, and the leg you are going to work in a straight position. As you lift your leg, contract the muscles located just behind, next to your glutes. Lift your leg up towards the ceiling, and then slowly lower it. Don't lift your legs with the tip of your foot leading. Your foot should be straight and flat, and you should feel the force in the heel. If you don't do it this way, you will be contracting the wrong muscle. The ideal for beginners is to do 2 sets of 10 repetitions with each leg, and increase as you feel stronger. We have already reviewed 5 exercises to strengthen your knees. Although they seem simple, you will notice the force you apply to your muscles, and within a few days, you will begin to notice the change, with relief from knee pain. The knee is a synovial joint, meaning it allows a wide range of motion. When we bend the knee, the femur moves backward on the tibia, and the kneecap slides into a groove in the femur. The muscles of the thighs and legs work together to produce this movement. Ligaments and menisci help stabilize the joint and prevent injury. To include these exercises in our routine, it is not necessary to wait until we are in pain or have an injury. It is good to practice them to keep our muscles toned and strong. In addition to strengthening the quadriceps and strengthening the knees, these exercises offer other benefits. Increases body awareness, allows you to connect better with your body and feel muscle activation. It is ideal for rehabilitation. It is a safe and effective exercise for people with injuries or mobility limitations. Can be done anywhere. It doesn't require any special equipment, so you can do it at home or anywhere with a flat surface. What problems can affect the knee? Arthritis. Inflammation of the joints, which can cause pain and stiffness. Ligament injuries. Tears of the ligaments, often caused by sprains or blows. Meniscus injuries. Tears of the meniscus, which can cause pain and limitation of movement. Cartilage wear. Osteoarthritis, which can cause pain and stiffness. Patella injuries. Misalignment or inflammation of the kneecap. How to take care of your knees. To keep your knees healthy, you can follow these tips. Maintain a healthy weight. Excess weight puts extra pressure on your knees. Strengthen leg muscles. Exercises like the ones we present in this episode can help strengthen the muscles that support the knee. Warm up before exercising. A proper warm-up can help prevent injuries. Wear proper footwear. Shoes with good support can help protect your knees. Avoid activities that put too much stress on your knees. If you have knee pain, avoid activities that make your symptoms worse. Taking care of our knees from an early age will prepare us for greater well-being in our golden years. I hope what we have shared helps you feel better and ease any pain you may be experiencing. Remember that consistency is the key. Incorporate these exercises into your daily routine, and you will notice the results in no time. If you have any questions or medical conditions, consult your doctor or physical therapist before beginning any exercise program. The knee is an essential joint for performing a wide variety of daily activities, from walking and running to jumping and bending. A healthy knee allows you to move easily and without pain. Strengthening your knees will allow you to enjoy a more active and healthy life. Get started today and feel the difference. I hope you enjoyed this video and start working those muscles. Let us know in the comments what you think of these exercises, which ones you practice, or if you have any other routines to relieve knee pain. Thanks for joining me. Don't forget to give us a like and subscribe to our channel for more health and wellness tips. See you soon.